In this video, I'm going to be demonstrating and explaining how to use these wedges to do one of the home care exercises that I prescribe. Now, this particular exercise is the decreased sacral base posterior L5 blocking. This is not an exercise that all of my patients have. You know if this is an exercise that you have. But the reason that I would have someone do this exercise, what we see on the x-ray, is that the pelvis is rotating backwards. So this is what I would see on the x-ray, is that the pelvis is rotating such as this. So this is likely what the person looks like. And our goal is to increase the rotation of the pelvis, which is going to take pressure off of the discs, which are the little pads between the vertebra. Because whenever there's more compression of the discs, those discs, one, are more likely to have a disc bulge or a disc herniation, but it will cause those discs to wear out much quicker than they should, which is arthritis, including, of course, causing pain and discomfort. So someone who has this exercise, they're going to be placing these wedges under the front of the pelvis, or the top front pelvic bones. So placing these wedges under those bones, pointed down and in towards each other. You're going to lie on the belly for 10 to 20 minutes per day, starting this exercise with 1 to 2 minutes and then adding some time as you feel more comfortable, but lying on it optimally for 10 to 20 minutes per day. Now, when you're lying on this at home, you're not going to want to have your face turned to the side. And naturally, you're going to want to breathe, and you don't want your nose touching the floor. So you're going to want to turn your head, but we don't want the head turned to the side for an extended time because that can cause problems with the neck or the cervical spine. So lie on these wedges right where I explained, right there and there. And you can use one of the rolls that you get in your home care kit, placing it under the forehead to keep the nose off of the floor. And you'll lie on these wedges again for 10 to 20 minutes per day. That is how to do the decreased sacral base posterior L5 blocking. If that's one of your exercises and you have any questions, please let me know.